So the software guides me through. So now left tragus superior, I take this pointer, put it to my tragus superior point and make the measurement. On the other side. Then this is the orbital point, it is the deepest bony point of the eye. Now the system wants to have my profile, so I go here. So, and now I can start to make, I give an addition to make the hinge axis. I try to make a hinge axis movement. So I have to push my lower toe back. Okay, the system detects now how good the hinge axis could be carried out. You see it here. So if it's possible, if you can see a point here in the center, that means I could make a hinge axis movement. Yeah. You see it on one side and on the other side. Yeah. And here you can see how good the hinge axis fit with the average of my pointer. You see I have some discrepancies here. And now I continue. And now I can start with a movement. Yeah? I can do all freedom of movement. See? You will see that one of my condyle pads is shorter than the other. So once I did this, I can start with a measurement. So I do the movement to the left side. Oh, sorry, it was wrong. No, it was right. It was right. To the right side. Sorry, this was wrong. So for that we can go back. No problem. So because I see it in the opposite way, okay. To the right side. Protrusion. Opening. This is a so-called portal diagram. You make the maximum movement what you can do. Same in the sagittal plane. So that's all finished. So save and close. You can give her your own name if you want. So and now I get already just an automatic analysis of the data. If I would give my age, I would also get normative ranges here. So what I have is, for example, I have an opening movement of 38 millimeters. I can see the movement to the left and the right side. Is there any limitation in the joint? For example, on one side I have 11 millimeters, on the other side are 10 millimeters, and I also see the condyle inclination angle what I have. So that's for very first diagnostic or analysis of the patient's ability. It's important if the patient gets some dental treatment, that if there is any disturbances, if there is a blockage in the joint, then it's better to make first treatment for the patient with a physiotherapist or another treatment before really making prosthetic work for the patient. Yeah? Same as in the software with a treadmill, we can follow up the movement, what I did, and I can switch off and switch on different movements here. Now it shows only opening postfrontal, and this is now switched off by double click. For example, I can also switch off this, and now the system will only showing the opening and closing movement. Here you can see the movement in the condyles while doing that. Yeah, and then I switch it again on. This can be turned. I can go into different screens here. This is a screen with average bony structure. I can also go to a 3D screen. Here you see my profile and the condyle path, and here is the reference plane. This is the orbital point. These are the condyle points. This is a reference plane, and of course it is possible also to let this move. This is so-called Bonville triangle between the an intercondylar axis to the incisal point here. And also there is possibility only to see the condyles, you see here, in a bigger presentation. This is left and right condyle, and this is the path from the top view, from the transversal view. And also it's possible to see just the incisal point. That is the point at the teeth in front. Always you have the possibility, once you see that, let me stop. You have the possibility to measure something. Once you go here, it is possible to go here and here and to measure a distance or to measure an angle. Yeah, you see here.
It is possible, as for the previous software, to put in pause the registration and continue the acquisition after a byte. Do you remember the work for the university in Rome? They make opening and they put a byte and they make other opening to see the change in the condyles.
Oh, we have to check it. Okay. Maybe it's possible. I first have to think about it. Then we can go into the report. So this is the report. Out of this, you see again the presentation of the different incisal range of motions, condyle tracks, limitations. Here you see the condyle axis movement. It's possible to see some disc displacement or anything out from this. Then here we have a special translation rotation diagram from my condyles. It shows how my condyles are moving. Is there any problem while moving my condyles here? This is the velocity of my condyle movement forward and backward. So if there is any problem with condyle, you can very easily see it here. And we have further, we show further the different curves here, what specialists want to have to analyze the function of the lower jaw movement. Yeah. Okay, any questions to the function analysis part? Everything unclear?
Yep.
Okay.